A wounded SEAL commander dismisses the new nurse with trembling hands, demanding a real professional instead. He doesn't realize those shaking fingers once clamped a femoral artery shut for 3 hours under enemy fire. When his platoon arrives bleeding from a classified op, and the hospital's doctors freeze at the ballistic trauma, she finally rolls up her sleeve, revealing a tattoo that stops every SEAL in the room cold. The commander who humiliated her must now choose his pride, or the only person in the hospital who can save his men. If you've ever been underestimated or know a hidden hero who deserves recognition, this story will hit home. Drop a comment sharing your thoughts. Let's honor those who serve in silence. Aurora Bennett's hands trembled as she restocked the medication cart at Naval Medical Center, San Diego. At 5'4", with dirty blonde hair pulled into a messy ponytail and oversized medium blue scrubs hanging loose on her frame, she looked exactly like what she pretended to be, a nervous, incompetent nurse, barely keeping her job. Her gray-blue eyes stayed lowered, focused on bottles she grabbed with shaking fingers that somehow never grabbed the wrong medication despite the tremor. "Bennett!" Dr. Marcus Thorne's voice cracked across the emergency department. "Where's the lidocaine I asked for 20 minutes ago?" Aurora flinched, shoulders hunching forward. The elastic band on her right wrist, her constant coping mechanism, dug into skin as she twisted it. I'm sorry, doctor. I thought Nurse Peterson was handling that. I'll get it right now." Thorne strode over, his 6-foot frame towering above her deliberately hunched posture. 34, catalog handsome with perfectly styled hair and a white coat so pristine it glowed. His Rolex caught the fluorescent light as he gestured dismissively. "You thought? I don't pay you to think, Bennett. I pay you to follow orders. 3rd time this week you've screwed up basic tasks." The other nurses looked away, familiar with this dynamic. Aurora was the department punching bag, 3 months at Balboa, and she'd established herself as exactly what she appeared, a timid woman unsuited for emergency medicine. "I'll get it now, doctor," Aurora whispered, hurrying toward the supply room. As she passed Trauma Bay 2, her eyes swept the room in one comprehensive glance. Patient positioning, equipment placement, exit routes. The scan took less than a second, muscle memory from another life, before she caught herself and looked down again. In the supply room, her hands shook, reaching for lidocaine vials. But despite the tremor, she grabbed the exact right concentration and volume without checking labels twice. Her fingers knew. They always knew. Pathetic. Dr. Caleb Sterling leaned against the doorframe. 36, 5'10", compensating for his height with aggressive gym physique shown off by scrubs a size too small. "How did you even pass nursing school, Bennett? You can barely handle a medication cart." Aurora's jaw tightened imperceptibly, controlled anger vanishing instantly. "I'm doing my best, doctor." "Your best is substandard." Sterling invaded her space. "I reviewed your file. Virginia Commonwealth, not exactly Johns Hopkins. Some rural Kansas clinic before this? How did you get hired at a naval medical center?" The answer was buried in paperwork Sterling would never check. Aurora had carefully constructed a mediocre civilian career, believable enough to be hired, unremarkable enough to be ignored. Employment gaps explained as family care, missing references from closed facilities, 3 years of deception, perfectly executed. "I needed a job, doctor," Aurora said softly. "I'm grateful for the opportunity." Sterling snorted. "Try not to kill anyone while being grateful. Get that lidocaine to Thorne before he has an aneurysm." Aurora delivered the medication without meeting Thorne's eyes, enduring another lecture. Fluorescent lights hummed overhead, casting greenish tint. The smell of antiseptic filled her nose, so different from copper and diesel that still haunted her dreams. "Bennett, check on bed 7, Thorne ordered, already dismissing her. "Probably another dependent with a sprained ankle. Try not to screw up basic vitals." Aurora shuffled toward bed 7, posture screaming submission. Then her ears caught something that tensed every muscle. Distant thump, thump, thump of rotor blades. A helicopter. Incoming fast. She paused, listening. The sound was wrong. Too aggressive, too low. Not standard medevac. The pitch, the urgency. That was a tactical bird coming in hot. "Bennett, are you deaf? Bed 7. Thorne's voice snapped her back. Aurora kept moving, but her mind calculated. Tactical helicopter at a naval hospital. Mid-afternoon Wednesday. Operational casualties. Trauma these civilian doctors hadn't seen since residency. The ambulance bay doors exploded open. "SEAL team inbound! Multiple GSWs! ETA 30 seconds!" The emergency department erupted. Doctors shouted orders. Nurses scrambled for supplies. Overhead speakers droned, "Trauma activation! All available personnel to Trauma Bay 1. Aurora stood frozen, watching organized chaos. Her hands shook, but not from nervousness. Every instinct screamed at her to move, to act, to do what she was trained for. They brought the first SEAL in. Even from across the department, Aurora saw he was bad, massive, bearded, wearing blood-soaked multicam pants and tan t-shirt, barely conscious on the gurney. 2 other SEALs flanked him in full kit, plate carriers showing distinctive trident patches. The team leader, commanding presence obvious, gave rapid-fire brief to Thorne. Techs took 2 to the vest. 1 got through the plate. Entry left upper chest. No exit. Sucking chest wound. Sealed in field, but he's been compensating 20 minutes and fading fast. BP was 110/70 at pickup. Probably lower now. "We've got it from here," Thorne interrupted, voice tight with stress beyond his comfort zone. "Get him to Trauma 1. Move." They rushed the SEAL past Aurora. She caught glimpses, mid-30s. Strong features gray with shock, lips blue. But what caught her attention was the chest wound. Field SEAL was good work, military-grade occlusive dressing, but placed slightly off-center. Not wrong enough to kill immediately, but wrong enough it wasn't fully addressing the pneumothorax. Aurora's hands clenched into fists. "Not your job. You're just a nervous nurse who can barely handle medication carts. Let them handle it." But she saw it clear as day. 15 minutes before pressure built enough to shift his mediastinum and stop his heart. 15 minutes before tension, pneumothorax coded him. And from Thorne's barely concealed panic, she wasn't sure he could see it at all. "Bennett! Stop standing there like a statue! We need all hands!" Sterling shouted. Aurora shuffled toward Trauma Bay 1, gait uncertain, eyes down. Controlled chaos deteriorated into just chaos. The SEAL team leader, name tape read Breaker, stood at the bay's head, presence dominating despite medical staff swarming his wounded teammate. 6'4", 240, red-brown tactical beard, ice-blue eyes missing nothing. Plate carrier dusty, rifle slung across chest, blood on his hands. "Vitals," Thorne barked. "BP 90/60, a nurse called. Heart rate 130. Respace 28, shallow. Sats 86%, dropping." "Shit." Thorne grabbed the ultrasound probe, hands fumbling. "Possible hemothorax. We need to—" "It's a pneumo," Breaker interrupted, voice a low rumble of absolute certainty. "Tension, pneumothorax. My corpsman called it in field. Your guy needs to decompress that chest right fucking now." Thorne's face flushed. "Sir, I appreciate input, but I'm the doctor." "We need imaging confirmation before we—" "He doesn't have time for imaging!" Breaker's voice rose to command Bark heard across the hospital. "His trachea's already deviating. Look at his neck!" Aurora, pretending to prepare IV supplies at the room's back, saw it too. Trachea shifting right, pushed by pressure building in left chest cavity. Classic sign, textbook presentation. 2 minutes until arrest. But Thorne froze, ego warring with uncertainty. "We need better IV access first. Get fluids running, then—" "Jesus Christ," Breaker breathed. And Aurora saw something she recognized intimately, a warrior watching his brother die from bureaucratic incompetence. Her hands steadied. For the first time in 3 months, the tremor stopped completely. Aurora's gray-blue eyes lifted from floor, locking onto the SEAL's chest. Her mind calculated. Second intercostal space, mid-clavicular line, 14-gauge angiocath, Straight insertion until air hissed out. 10 seconds, tops. Her feet moved before her brain stopped them. 2 steps toward trauma bay, close enough to smell blood and sweat and fear. Then she caught herself. Not yet. She forced herself back, eyes lowering, hands resuming artificial tremor. But Breaker's head turned. Ice-blue eyes found hers across the room. For a fraction of a second, their gazes locked. He saw something. Aurora didn't know what exactly, but she saw his eyes narrow slightly, saw minute posture change, shift from aggressive frustration to tactical assessment. BP 80/50, the nurse called, voice rising with panic. Sats down to 82. Doctor, he's crashing. All right. Thorne grabbed ultrasound again, hands shaking. Someone get me. Where's the needle decompression kit? Where the hell is it? 3rd drawer, right side crash cart, Sterling shouted, but he wasn't moving either. Both doctors paralyzed by unfamiliarity with real combat trauma, the kind that didn't wait for imaging and consultations. Aurora watched the SEAL's lips turn from blue to purple. Watched his eyes start rolling back. Watched his teammate, this huge, terrifying warrior, grip the gurney hard enough to make metal groan. Please, Breaker said, word coming out broken. Please, somebody help him. The elastic band on Aurora's wrist snapped. She'd been twisting it unconsciously, tension finally exceeding material capacity. It broke with soft pop nobody else heard, falling to floor in 2 pieces. Aurora looked down at it, then looked up at the dying SEAL, and made a choice. Aurora's hand stopped shaking as she stepped forward. Her fingers found the 3rd drawer, needle decompression kit, 14-gauge angiocath. 80%, the nurse called. Doctor, we're losing him. I can see that, Thorne snapped, fumbling with ultrasound. Just give me a second. He doesn't have a second, Breaker growled. Aurora moved. 2 steps to the SEAL's left side, hand finding landmarks automatically. 2nd intercostal space, mid-clavicular line. Bennett, what are you? Sterling started. Aurora ripped packaging with her teeth, non-civilian gesture that made Breaker's eyes widen. She positioned the needle. Bennett, stop! Thorne lunged, too slow. Aurora drove it home. Hiss! Trapped air escaped. Tension pneumothorax converting to simple pneumo. The SEAL gasped, huge whooping inhalation. Monitor alarm cut off. Oxygen saturation climbed. 82, 85, 88. Color changed from purple-gray to pink. Aurora withdrew the needle, leaving catheter, secured it. Fast, efficient, professional. No tremor. The trauma bay went silent. Everyone stared at the small nurse who'd just performed combat-level medicine. Who the fuck are you? Breaker asked quietly. Aurora's hands started shaking again. She stepped back, eyes dropping, shoulders hunching. Nervous nurse again. I'm sorry, she stammered. He was dying and I shouldn't have. You just performed a procedure outside your scope, Thorne's voice strangled. You saved his life, Breaker interrupted. That was perfect placement, field medicine. I took an advanced trauma course once, Aurora said, not meeting eyes. I just remembered the landmarks. BP 100/70, the nurse said softly. Heart rate 110. Sats 94. He's stable. Tex coughed, eyes opening. The fuck happened? Someone saved your life, Breaker said. Eyes never leaving Aurora. Aurora backed toward door. I should go. I'm sorry. Bennett, Sterling said ice cold. My office. Now. Actually, Thorne interjected, we need a serious conversation about your future employment. Unauthorized procedure. Are you fucking kidding me? Breaker's voice dropped lethal. She saved my teammate, and you're threatening to fire her? This facility has protocols, Thorne said stiffly. Massive liability. The only liability I see, Breaker interrupted, stepping toward Thorne predatory, is a doctor who was about to let a SEAL die because he was too scared to make a call. Breaker. New voice. Another SEAL entered. Larger than Breaker, gray beard, Master Chief insignia, name tape, Havoc. Stand down. Havoc's gaze swept the room. Ma'am, what's your name? Aurora. Aurora Bennett. Well, Aurora Bennett, on behalf of SEAL Team 5, thank you. He turned to Thorne. Doc, we've got 3 more inbound. 2 priority, 1 urgent. ETA 5 minutes. I need your A-team, not a pissing contest. Thorne paused, at war with himself. Bennett, you're assigned Trauma 2. Pull another stunt. You're done. But right now, I need all hands. Aurora hurried out, gait returning to uncertain shuffle. She made it to the supply room before legs gave out, sank onto linens, head in hands. 3 months of cover, blown in 10 seconds. The door opened. Breaker. He closed it, massive frame blocking exit. Plate carrier dusty, rifle slung, blood on hands. That wasn't a trauma course, Breaker said. I've seen corpsmen with 5 years who couldn't place a needle that fast. I don't know what you mean. Bullshit. The way you moved. Found landmarks without looking. Ripped seal with your teeth because you needed both hands. That was combat medicine. I'm just a nurse, Aurora whispered. Look at me, Breaker said, crouching to eye level. Slowly, she raised gray-blue eyes to ice-blue ones. Who are you, really? Long silence. I'm nobody. Just a nurse who got lucky. Please, let it go. Can't do that. Breaker reached slowly, took her left wrist. May I? He pushed up sleeves, exposing forearm. The tattoo. Eagle, globe, anchor with caduceus. Map of Fallujah's Jolan district. Skull and bones. Gothic script. So others may live. Breaker went still. Holy shit. You're the Reaper. Aurora closed her eyes. That name died long ago. The Reaper of Jolan. Navy corpsman who ran triage for 3-5 during Phantom Fury. Held a gunny's femoral artery closed for 3 hours. Worked chest wounds in firefights. They said you died. IED strike on FRSS. I did die, Aurora said softly, pulling sleeve down. Reaper died in that strike. Aurora Bennett crawled out of rubble. Why are you here, pretending to be scared civilian nurse? Because I can't be that person anymore, desperation in voice. Every time I put on uniform, I smelled burning flesh, saw faces, ones I couldn't save. I needed out, needed to be normal. So you came to a naval hospital. I couldn't leave them completely. Marines, corpsmen, SEALs, still my people. Just needed to treat them without the rank, without being the Reaper. Just wanted to be Aurora, mediocre nurse under the radar. Breaker stood, offering hand. Bad news. You just saved techs in front of half the ED and a SEAL team. Your under-the-radar days are over. Please don't tell anyone. I just want to do my job. Can't promise that. Havoc has questions. When Tex wakes up, he'll want to thank you. I don't want thanks. I want to be left alone. Door burst open. Young nurse. Bennett, Trauma 2. Dr. Sterling specifically asked for you. Aurora's head jerked up. He asked for me? He said, get Bennett. She knows what she's doing better than the rest of us. Aurora stood, shaky, looked at Breaker. Please, I'm asking as someone who used to serve. Don't make me into something I'm not anymore. Breaker studied her, then nodded slowly. Your secret's safe. But Aurora, secrets come out. Especially when written in ink on your arm. Trauma Bay 2, controlled chaos. 2 SEALs with ballistic trauma, 1 with blast concussion. Sterling worked on Latino SEAL, late 20s, through and through GSW to thigh, nicked femoral artery. Bennett, pressure, now! Aurora moved, hands to wound, direct pressure. SEAL, name tape Atlas, groaned. She felt arterial pulse, calculated blood loss. How much lost? Sterling startled at her steady tone. Maybe 2 liters? 2.5. Pressure dropping in 90 seconds without volume. Need to clamp or pack. Direct pressure isn't enough. You're right. Tracy, clamps. 2 units ONEG. Different from Tex's chaos. Controlled. Professional. Sterling was competent minus ego. On 3, release. 1, 2, 3. Sterling clamped first try. Aurora packed with combat gauze. 2 minutes. Atlas stabilized. Good work. Where'd you learn that? Advanced trauma course. Bullshit. Field experience. Who are you really? Door opened. Havoc. Master Chief dominated room. Sterling stepped back. How's Atlas? Stable. Surgery in 5. Keeps the leg. Good. Havoc looked at Aurora. I hear you were instrumental. Breaker tells me you have interesting skills. I don't know what you mean. Havoc. I think you know. But I'm here to say thank you. Tex is my godson. You saved his life. That means something. Aurora's chest tightened. Just glad he's okay. He's asking for you. Wants to thank you. I don't think that's a good idea. In our community, when someone saves your life, you look them in the eye and say thank you. I'm asking. Please. Genuine gratitude in weathered face. Okay. When he's settled. Thank you. Havoc turned, paused. I don't know what you're running from, but teams take care of their own. You've got brothers who owe you. He left. Sterling stared. What's going on? Who are you? Nobody, Hollow. I'm nobody. Locker room. Adrenaline fading, shaky. Aurora stripped blood-stained top. Mirror reflection. Thermal sleeve underneath. Tattoo edges at wrist. She rolled up sleeve. Jolan map. Caduceus. Skull and bones. So, others may live. Door opened. Aurora spun, pulling sleeve down. Too late. Thorn in doorway, eyes on forearm, on tattoo. You're military. Was. Past tense. Grabbed clean scrub. Thorn stepped in, door closing. What branch? Unit? Does it matter? It matters if you lied on application. Concealed experience. If what? If I'm more qualified than you thought? If I'm not the pathetic nurse you've been treating like garbage for 3 months? Jaw tightened. I've been professional. You've been an asshole. You and Sterling. Mocked me, belittled me, questioned my competence. Made my life hell because I fit your stereotype of incompetent. You presented as incompetent. I presented as someone who wanted to be left alone, came to do my job quietly, didn't want attention, just wanted to care for patients and be normal for once. Then why hide military experience? Aurora looked him dead in the eye. Because last time I was honest, I spent 6 months at recruitment events and ceremonies while my friends died in Ramadi. Every time I tried working, some admiral wanted speeches about service and sacrifice. I was more useful as propaganda than corpsman. When I got out, I buried that person and tried building something new. Silent. Then quieter. What unit? Aurora sighed. 3rd Battalion, 5th Marines. Surgical Company Bravo. Senior corpsman attached to FRSS during Operation Phantom Fury. Eyes widened. Fallujah. Yeah. November and December 2004. Bloodiest urban combat since Hugh City. I treated more sucking chest wounds and amputations in 8 weeks than you'll see in your career. When they pulled us out, I had PTSD so bad I couldn't sleep without seeing their faces. So yes, I have experience, but I don't advertise it because I'm trying to leave it behind. Thorn looked shaken. I didn't know. You didn't ask. Saw a middle-aged woman with shaky hands. Assumed incompetence. Never considered maybe there was a reason for tremor. Maybe some shake because we've seen too much, not because we don't know what we're doing. I'm sorry, I was wrong. Yes, you were. Moved to door, paused. For what it's worth, you handled Atlas well. You're a good surgeon when ego doesn't make decisions. ICU quieter, lighting softer. Techs in Bay 3, monitors surrounding. Awake, color better, chest tube draining. Breaker beside bed, Havoc near window. Both looked up. There she is, Tex said, voice rough but stronger. Woman who stabbed me in the chest. Small smile. Technically, decompressed your pneumothorax. Technically, saved my life. Held out hand. Tyler Morrison. Friends call me Tex. Shook gently. Aurora Bennett. The Reaper, Havoc added quietly. Eyes snapped to Breaker. You told him? Havoc's our senior chief. He needed to know. I'm not dealing with anyone. Just the corpsman who held line at Jolin 12 hours when FRSS got cut off, Havoc interrupted. Who treated 67 casualties in building taking fire. The legend every Marine corpsman tried living up to. Pause. My daughter was in your unit. HM2 Sarah Hendricks. Breath caught. Hendricks. She was good. She made it home because of you. IED strike, December. She said you pulled her from wreckage, treated burns while truck was on fire. Wouldn't leave until everyone was accounted for. Aurora remembered. Heat, screaming, diesel and burning flesh. Dragging Hendricks out, burns on face and hands, working while explosions rocked street. She's a commander now, running clinic at Pendleton, named her daughter after you. Aurora sat down, legs giving out. Aurora didn't go home that night. She sat in the ICU break room nursing cold coffee while Tex slept, and Breaker kept watch. The hospital had grown quiet in that peculiar way medical facilities do at 0300. Not silent, but subdued. Punctuated by monitor beeps and distant footsteps. You should go home, Havoc said, appearing in the doorway with 2 fresh cups of coffee. He handed her one. Your shift ended 6 hours ago. Couldn't sleep anyway, Aurora admitted, accepting the cup. The scar above her left eyebrow itched. It always did when she was stressed. Old shrapnel wound from the FRSS strike. Too many memories stirred up today. Havoc settled into the chair across from her. Without his tactical gear, dressed in civilian clothes, jeans and a SEAL Team 5 t-shirt, he looked less imposing but no less capable. Sarah talks about you sometimes, my daughter. She says you're the reason she became a corpsman instructor, wanted to teach others what you taught her. Aurora's throat tightened. I didn't teach her much, just how to stay alive long enough to get the job done. That's everything in our world. Havoc sipped his coffee. She told me about the convoy. Said you were treating casualties in the back of a burning MRAP, wouldn't evacuate until you'd triaged everyone. The truck's fuel tank was leaking, ammunition cooking off in the heat, and you just kept working. I couldn't leave them. I know. That's what makes you the Reaper. Havoc's weathered face was kind but serious. But Aurora, hiding here, pretending to be incompetent, that's not staying alive. That's just existing. There's a difference. Before Aurora could respond, alarms erupted from Tex's room. Both of them were moving before the sound registered consciously, muscle memory, combat reflexes. They burst through the door to find Tex sitting up, eyes wide, hands clawing at the chest tube. A nurse was trying to calm him, but he was in full flashback, seeing enemies instead of hospital staff. Tex! Breaker gripped his teammate's shoulders. Brother, you're at Balboa. You're safe. It's Breaker. You're home. But Tex wasn't hearing him. His eyes were locked on some horror only he could see. Contact left. They're in the building. Miller's down. We need... He tried to rip out his IV line. Aurora moved without thinking. She positioned herself directly in Tex's line of sight, close enough that he had to focus on her face. Petty Officer Morrison, she said. Voice dropping into command tone. The voice she'd used in Fallujah when Marines were panicking. I need you to look at me. Look at my eyes. Tex's gaze locked onto hers. Gray-blue meeting brown. Present, fighting past. You are at Naval Medical Center, San Diego, Aurora continued, each word precise and calm. The date is November 16th, 2024. You were wounded in action. You had a pneumothorax. I decompressed it. You are safe. Your team is here. Breaker is right beside you. She could see the moment reality filtered back in. Tex's breathing slowed, recognition dawning. Reaper, he whispered. Yeah, it's me. You're okay. You're home. Tex slumped back against the pillows, trembling. Jesus. I thought I was back there. The firefight in Kandahar. We lost 2 guys in that building and He stopped, swallowing hard. Aurora pulled up a chair, never breaking eye contact. What you're experiencing is normal. Your brain is processing trauma. The sounds, the smells, they're triggers.
The chest tube probably reminded you of being wounded. Your nervous system kicked into survival mode. How do you make it stop? Tex asked, and there was something raw and vulnerable in the question, a warrior admitting he was struggling. Aurora was quiet for a moment. You don't make it stop. You learn to ride it out. You develop strategies.
Deep breathing. Grounding techniques. You identify your triggers and you prepare for them. She paused. And you talk about it. With your team. With professionals. You don't hide it and pretend you're fine. She was talking to herself as much as to Tex. Is that what you do? Breaker asked quietly. Or is that what you wish you'd done? Aurora met his ice-blue gaze. Both. The nurse, an older woman named Patricia who'd been working nights for 30 years, cleared her throat. I'll get the on-call psychiatrist. We should document this episode. After she left, Havoc spoke. Tex, you remember what we talked about before deployment? About getting help if you need it? I remember, Tex muttered. Just didn't think I'd be the one who needed it. Everyone needs it eventually, Breaker said. Even the Reaper. He looked at Aurora. Right? Aurora wanted to deflect, to change the subject, to retreat into her comfortable invisibility. But 3 sets of eyes were on her. 3 warriors who'd just watched her handle a PTSD episode with the kind of expertise that only came from personal experience. I see a therapist, Aurora admitted. VA counselor, twice a month for the past 3 years. It helps. Not enough to make the nightmares stop completely, but enough that I can function. Enough that I don't jump every time a car backfires. And the tremor in your hands? Havoc asked gently. Anxiety response. Gets worse when I'm stressed or when I'm trying to maintain the act. When I'm actually doing medical work, real work, like today, it goes away. My brain knows what it's doing, trusts the training. So hiding here, pretending to be scared and incompetent, that actually makes your PTSD worse, Breaker said. It wasn't a question. Aurora hadn't thought about it that way, but he was right. The constant performance of anxiety, the deliberate triggering of her stress responses to maintain her cover. It had been reinforcing the very symptoms she was trying to manage. Yeah, she said quietly. I guess it does. Tex laughed, a rough, bitter sound. We're a mess, aren't we? Bunch of broken warriors trying to figure out how to be human again. You're not broken, Aurora said firmly. You're injured. There's a difference. Broken means unfixable. Injured means you need time and treatment to heal. Your body knows how to heal physical wounds. You just watched it do that today. Your brain knows how to heal psychological ones too. It just takes longer, and the scars are invisible. Is that what your therapist tells you? Tex asked. That's what I learned the hard way. Aurora stood, suddenly exhausted. I should go. Let you rest. Aurora. Havoc's voice stopped her at the door. Thank you. For being here. For helping him through that. She nodded and slipped out. The hallway was empty except for a janitor buffing the floors. Aurora made it to the parking lot before the shaking started. Real shaking this time, not performance. She sat in her 15-year-old Honda Civic, hands gripping the steering wheel, and let herself feel everything she'd been suppressing for 12 hours. The fear when Tex started coding, the fury at Thorne and Sterling for their arrogance, the shame of being discovered, the relief of using her real skills again, the terror of what came next. Her phone buzzed. Text from an unknown number. It's Breaker. Havoc gave me your number from hospital records. You left before we could ask. We're having a team dinner tomorrow night. Nothing formal, just food and beer. You should come. You're family now. Aurora stared at the text for a long time. Family. She'd been running from that word for 3 years. Terrified of the weight of it, the responsibility, the inevitable loss that came with caring about warriors who lived dangerous lives. But sitting alone in a dark parking lot, hands shaking from suppressed trauma, she realized Havoc had been right. This wasn't living. This was just existing. She typed back, "What time?" 3 dots appeared immediately. 1800. I'll send you the address. Casual clothes. No rank, no bullshit. Just family. Aurora put the phone down and started the car. As she drove home through the empty San Diego streets, she caught sight of her reflection in the rearview mirror. For the first time in years, she didn't look away from her own eyes. Maybe the Reaper wasn't dead after all. Maybe she'd just been sleeping. And maybe, just maybe, it was time to wake up. But first, she had to survive tomorrow. Because Monday morning she was walking into Naval Medical Center knowing that Dr. Marcus Thorne had spent his weekend making decisions about her future. And those decisions would change everything. Monday morning hit like a mortar round. Aurora walked through Balboa's entrance at 0645, back in her oversized blue scrubs, hair in a messy ponytail, hands trembling just enough to sell the act. But something had shifted inside her. She'd spent Sunday at that team dinner, burgers and beer with Breaker, Havoc, Tex, who'd checked himself out AMA, and 3 other SEALs from Team 5. No rank, no pretense, just warriors sharing stories and bad jokes. For the first time in 3 years, she'd felt like herself. Now, walking toward Thorne's office for the Euro 700 meeting he'd demanded via terse email, she felt the familiar anxiety creeping back. But underneath it was something else, something harder. The Reaper, stirring. Thorne's office was pristine as always. He sat behind his desk, Sterling in the chair beside him. Both doctors looked up when she entered. "Sit," Thorne said, gesturing to the chair across from them. Aurora sat, hands folded in her lap. Waiting. "I've spent the weekend reviewing your situation," Thorne began. He slid a folder across the desk. "I spoke with administration, legal counsel, and the chief of staff. We have a proposal for you." Aurora opened the folder. Inside was a formal job offer. Senior trauma nurse, emergency department, with a specialty designation in combat casualty care. The salary made her blink. It was nearly double what she was making. "We want to establish a training program," Sterling added, and for once there was no condescension in his voice. "Teach our staff how to handle military trauma. You'd design the curriculum, run the drills, supervise critical cases. You'd report directly to me and Thorne. But you'd have autonomy over the program." "There's a catch," Thorne said. "You'd need to be honest about your background. We'd need to verify your service record, get copies of your certifications, your commendations. No more hiding." Aurora stared at the offer letter. Everything she'd run from, packaged as an opportunity. "And if I refuse?" "Then you continue as you are," Thorne said. "Medication cart duty, basic triage, being treated like an incompetent. But Aurora, I saw your face when you saved those SEALs. You need this. Not for us, for you." Before Aurora could respond, the hospital's overhead speakers crackled to life. "Code Silver, Emergency Department. Code Silver. Emergency Department. All personnel initiate lockdown protocols. Code Silver. Active threat." Aurora was moving before conscious thought kicked in. She bolted from Thorne's office, the 2 doctors scrambling behind her. As they hit the stairwell, elevators automatically locked during Code Silver. She heard it. Gunfire. 3 shots. Distant, but unmistakable. The sharp crack of a rifle, not the pop of a handgun. "Stay here," she ordered Thorne and Sterling, her voice dropping into command tone. "Lock yourselves in the nearest room and don't come out until security clears the floor." "Bennett, you can't," Thorne started. Aurora was already gone, taking the stairs 3 at a time down toward the ED. Her mind shifted into combat mode, all pretense falling away. She assessed as she moved. Active shooter in the ED. Morning shift just started, so maximum personnel present. Patients in beds. SEALs in ICU 4 floors up. She burst through the stairwell door into chaos. The ED waiting room had scattered. Civilians diving behind furniture. Staff trying to evacuate patients. And in the center of it all, Aurora saw them. 4 men in black tactical gear, suppressed rifles, moving with professional precision. Not random shooters, operators. One of them had a nurse, young Jessica by the arm, using her as a human shield. Another was dragging a gurney toward the ambulance bay. On that gurney, barely conscious and handcuffed to the rails, was Tex, Extraction team. They'd come for the seal. Aurora's combat brain cataloged everything in 2 seconds. 4 hostiles, professionally trained, suppressed weapons meant they wanted stealth, not spectacle. Tex was the target. Jessica was collateral. Hospital security was outgunned. She needed weapons. The ED didn't have guns, but it had other options. Aurora moved along the wall, using overturned furniture for cover. Her hands, rock steady now, zero tremor, grabbed a crash cart and shoved it hard. It rolled across the floor and slammed into the legs of the hostile dragging Tex. He stumbled, grip on the gurney loosening. The man holding Jessica swung his rifle toward the crash cart, trying to identify the threat. Aurora was already moving. She grabbed a fire extinguisher from the wall mount, pulled the pin, and sprayed a cloud of chemical foam directly into his face. He released Jessica, hands going to his eyes, choking on the suppressant. Aurora grabbed Jessica and shoved her toward the supply room. "Run! Lock yourself in!" Then she turned to face 4 very angry operators who just realized they had a problem. "Who the fuck?" The one she'd blinded started, but Aurora didn't let him finish. She swung the empty fire extinguisher like a club, connecting with his temple. He dropped, unconscious before he hit the ground. 1 down. 3 to go. The others were bringing their rifles around, but they were hesitating. Tight quarters, civilians everywhere. Suppressed rounds or not, they couldn't risk massive collateral damage. Aurora used that hesitation. She grabbed an IV pole, yanked it free from its stand, and used it like a spear, driving the metal post into the shoulder of the nearest hostile. He screamed, rifle clattering to the floor. 2 down. The remaining 2 had better tactical sense. They separated, creating crossfire lanes. One moved to protect Tex's gurney, while the other advanced on Aurora, rifle up but not firing. He wanted to take her alive, probably to question how a random nurse was engaging them with combat tactics. Aurora's eyes swept the ED. Defibrillator cart, 3 feet to her left. Medication cabinet, behind her. Oxygen tank, against the far wall. Fire alarm, 6 inches from her right hand. She pulled the fire alarm. Instantly, the overhead sprinklers activated, drenching everyone. Water sheeted down, reducing visibility, making the floor slick. In the chaos, Aurora grabbed a scalpel from the nearby supply tray. Small, surgical steel, wickedly sharp. The hostile closing on her didn't see it until too late. Aurora moved inside his rifle's effective range, using a knife-fighting technique she'd learned from a Marine Scout sniper in Ramadi. She sliced through the sling, kicked his knee to destabilize him, and as he fell, she grabbed his rifle. 3 down. The last hostile, the one guarding Tex, made his choice. He abandoned the gurney and ran for the ambulance bay exit, deciding mission failure was better than getting killed by whatever the hell Aurora was. She let him go. Her priority was Tex. Aurora reached the gurney, breathing hard, soaking wet, still holding the scalpel in one hand and the captured rifle in the other. Tex stared up at her with wide eyes. "Reaper?" he gasped. "What the fuck was that?" "That," Aurora said, dropping the rifle and pulling out the handcuff key from the unconscious hostile's belt, "was me being done hiding." She freed Tex just as the stairwell doors burst open. Hospital security poured in, weapons drawn, followed by Breaker and Havoc, both armed, both in civilian clothes, but moving like the operators they were. "Aurora!" Breaker's eyes went wide, taking in the scene. 3 unconscious hostiles. 1 fled, Aurora standing over Tex with a scalpel. Soaking wet from the sprinklers, not a tremor in her hands. "SEAL extraction team," Aurora reported, slipping automatically into tactical brief. 4 operators. 1 escaped via ambulance bay. 3 neutralized. No civilian casualties. 1 operator has a shoulder injury from blunt force trauma, needs medical attention. The one I hit with the extinguisher has a possible concussion. Target, she gestured to Tex, is secure. Havoc moved to check the unconscious hostiles while Breaker approached Aurora. "You took down 3 trained operators by yourself, with hospital equipment?" "I improvised." Aurora's adrenaline was starting to fade. leaving her shaky for real now. They were professional, but they hesitated in a civilian environment. I didn't. No, Breaker said quietly, something like awe in his voice. You sure as hell didn't. Hospital security was securing the scene, zip-tying the unconscious hostiles. One of them, the guy Aurora had hit with the extinguisher, was coming around, groaning. Aurora grabbed his tactical vest, hauled him up with strength that shouldn't have been possible from someone her size, and got in his face. "Who sent you?" she demanded. "Who paid you to extract him?" The man just glared at her, silent. Aurora's hand went to the scalpel still in her pocket. She didn't pull it out, didn't threaten him. But something in her eyes, something cold and absolutely certain, made him reconsider. "Private contractor," he spat. "We got paid to grab the seal. No questions asked. Anonymous client. That's all I know." "Blackwell?" Aurora asked, naming one of the major PMCs. "No names, just wire transfers and target photos." He looked at her with grudging respect. "Who the hell are you, lady? You fight like Tier 1. "I'm nobody," Aurora said, releasing him. But her voice carried differently now, not the scared nurse, not even the hidden reaper. Something new. Something that was both. Thorne appeared at the ED entrance, soaking wet from running through the sprinklers, Sterling behind him. Both doctors stared at the scene with expressions of absolute shock. "Bennett," Thorne said slowly. Did you take down an entire assault team?" "3/4 of one," Aurora corrected. "The fourth one got away." "I'll need to file an incident report." "An incident report," Sterling repeated numbly. "You just went full Jason Bourne on armed contractors, and you want to file an incident report." Aurora looked down at herself. Soaking wet, blue scrubs plastered to her body, revealing the athletic build she'd been hiding for months. No more oversized clothes. No more hunched shoulders. She stood at her full height, which admittedly wasn't much at 5'4", but her presence had changed completely. "Yeah," she said. "I'm going to need to file a report. And then," she turned to Thorne, "I'm going to need to accept that job offer because clearly I'm not very good at hiding anymore." Breaker laughed. A sharp bark of sound. "No, Reaper! No! You are not!" Behind them, the first San Diego PD units were arriving, sirens wailing. Federal agents would follow. Attempted kidnapping of a Navy SEAL on a military installation was FBI jurisdiction at minimum. There would be interviews, debriefs, probably congressional hearings. Aurora's cover wasn't just blown, it was nuclear. But standing there in the destroyed ED, surrounded by warriors who knew exactly who and what she was, Aurora felt something she hadn't felt in 3 years. Free. The Reaper had come back. And this time, she wasn't going anywhere. The FBI arrived 40 minutes after the attack, followed by NCIS agents who looked distinctly unhappy about attempted kidnapping on federal property. Aurora sat in an empty patient room, still damp from the sprinklers, giving her statement for the 3rd time. The agent across from her, Special Agent Rebecca Chen, kept glancing at her notes with an expression of professional skepticism. "Let me make sure I have this right," Chen said. "You, a civilian nurse, engaged 4 armed contractors using a fire extinguisher, an IV pole, and a scalpel. You neutralized 3 of them, rescued the target, and provided tactical assessment to security, all within approximately 3 minutes. 2 minutes 40 seconds, Aurora corrected. The sprinklers added time. "And your background is?" Chen flipped through her tablet. "Navy Corpsman, 2003 to 2005. Attached to 3rd Battalion, 5th Marines. I served in Fallujah during Operation Phantom Fury." Aurora's voice was steady, matter-of-fact. No more hiding. "I was trained in combat casualty care and close-quarters defensive tactics. What I did today was apply that training to a threat situation." Chen's expression shifted from skepticism to understanding. "You're the Reaper, the one from Jolin District." "That's what they called me." "Holy shit." Chen sat back. "I was Army. Did a tour in Ramadi in 06. We heard stories about you. They said you were killed in an IED strike." "I got better," Aurora said dryly. The door opened. A Navy captain in dress whites entered, Captain James Riker, commanding officer of Naval Medical Center San Diego. He looked at Aurora with an expression that mixed respect, confusion, and bureaucratic concern. "Ms. Bennett, I need to speak with you privately," Riker said. Chen nodded and left. Once the door closed, Riker pulled up a chair. "I've spent the last hour on calls with BUMED, Nav Spekwar, and about 6 different admirals who are all very interested in you. Do you know what you've done? Stopped the kidnapping? You've created a political nightmare," Riker said, but there was no heat in it. A supposedly civilian nurse engaging military contractors with combat tactics on a Navy installation. The media is going to go insane. Congress is going to want hearings. And every security protocol we have is being questioned because nobody knew we had a combat veteran working here under false pretenses. Aurora met his gaze steadily. "I didn't lie on my application. I listed my nursing credentials, which are valid. I omitted my military service, which I had every legal right to do. Technically correct," Riker acknowledged. "But Aurora, and I'm going to use your first name because rank feels ridiculous right now. You can't go back to being invisible after this. The video footage from security cameras is already being reviewed. You're going to be identified. Your service record is going to be pulled. The Reaper is about to become very public again." "I know," Aurora said quietly. "I've been running from that for 3 years. I'm tired of running." Riker studied her face. "Dr. Thorne submitted a formal proposal this morning for a new trauma training program. He wants you to lead it. But there's another option." He pulled out a folder. "Nav Spekwar wants you back. They're offering you a direct commission as a Navy Nurse Corps officer, O3 rank, with assignment to NS Dadaler's medical training. You'd be teaching corpsmen who support SEAL teams." Aurora took the folder but didn't open it. "What do you think I should do?" "I think," Riker said carefully, "that you need to decide what the Reaper is going to be now. Are you a warrior who treats patients? Or are you a caregiver who can fight when needed? Because those are different things, and only you know which one fits." After Riker left, Aurora sat alone with 2 folders, Thorne's civilian job offer and the Navy's commission. Both represented a future. Neither was the invisible existence she'd been clinging to. A knock on the door. Breaker entered, followed by Havoc and Tex, who was back in a hospital gown but insisting on walking. "You good?" Breaker asked. "Define good," Aurora replied. "Not shot, not arrested, not having a breakdown," Tex offered. "That's my current metric for good." Aurora managed a smile. "Then yeah, I'm good." Havoc settled into the chair Riker had vacated. "We need to talk about what happened. Those contractors weren't random. Someone hired them specifically to grab Tex. Someone who knew he'd be here, knew his condition, knew the layout of this hospital." "Inside information," Aurora said. "Which means someone with access to medical records or security protocols." "NCIS is investigating," Breaker added. "But Aurora, there's something else. The 4th contractor, the one who got away, we found his abandoned vehicle 3 blocks from here. Inside it was a second target folder." He pulled out a photo. "You." Aurora stared at her own image. A surveillance photo taken outside Balboa, showing her in her oversized scrubs, shoulders hunched, looking exactly like the scared nurse she'd been pretending to be. "They were going to take both of us," Tex said quietly. "Me because of what I know about the op we just ran. You because someone figured out who you really are." "Who knew?" Aurora asked. "Before today, I mean. Who knew I was the Reaper?" "Just the team," Havoc said. "And we sure as hell didn't tell anyone." Which meant someone else had identified her. Someone with resources, surveillance capability, and motivation to grab both a SEAL operator and a legendary corpsman. The door opened again. This time it was Dr. Sterling, and he looked shaken. "Aurora, I need to tell you something," he said without preamble. 2 weeks ago, a pharmaceutical company rep came to the hospital, said they were doing research on combat trauma treatment protocols. They were very interested in our staff, particularly anyone with field experience. I mentioned you. Not by name initially, but they pressed for details. I told them we had a nurse who seemed to have advanced trauma knowledge. Aurora's blood ran cold. Did you give them my name? No, but they could have accessed staff rosters. Sterling looked genuinely horrified. I didn't think, I was just making conversation. I didn't realize I was putting you in danger. What company? Breaker demanded. Raven Biomedical. They're supposedly developing new hemostatic agents for military use. Havoc pulled out his phone, typed rapidly. His face darkened. Raven Biomedical is a shell company. Corporate registration traces back to a holding group in the Caymans, but the CEO is former Blackwell Security. Aurora, this wasn't about research. This was reconnaissance. The pieces clicked together. Someone wanted to grab experienced military medical personnel. Tex was secondary. Aurora was always the primary target. They wanted the Reaper, probably to exploit her knowledge of combat trauma protocols, possibly to force her to train their people or work in some black site medical facility. This is bigger than we thought, Aurora said. If they're targeting combat corpsmen and medics, I'm not the only one at risk. No, Havoc agreed. Every Navy corpsman, every Army medic who's seen real action, they're all potential targets. Aurora stood, decision crystallizing. Then we need to stop them. But I can't do that from hiding. She looked at the two folders on the table, civilian job offer and Navy commission. Then she looked at Breaker, Havoc, and Tex. I need to go back, not to active duty, but to training. If someone's hunting military medical personnel, we need to make sure every corpsman and medic knows how to defend themselves and their patients. The Navy commission, Havoc said, teaching at Nessa dollars. Yeah, but on my terms. I don't do ceremonies. I don't do publicity, I just teach. Breaker smiled. That's very Reaper of you. 3 hours later, Aurora stood in the hospital's main conference room facing what felt like a tribunal. Captain Riker sat at the head of the table, flanked by hospital administration, legal counsel, and, via video conference, a Navy admiral and an NCIS director, Ms. Bennett, the admiral began. We've reviewed your service record. It's exemplary. Your actions today were exemplary, but they've created complications. I understand, sir. The question before us is what happens next. You have 2 offers on the table, but there's a third option. The admiral's expression was serious. You could walk away. We seal your records, you disappear again, and none of this becomes public. The contractors we captured won't talk about who engaged them, professional pride, and we can spin the story as security forces neutralizing the threat. Aurora was surprised. You'd let me disappear? You've earned that right, the admiral said. What you did in Fallujah, what you sacrificed, you don't owe us anything more. If you want out, you're out. It was tempting. So tempting. Return to invisibility, to safety, to the quiet existence she'd built. But Aurora thought about Tex's PTSD episode, about Sarah Hendricks naming her daughter after her, about the young corpsman who'd follow in her footsteps, heading into combat zones without the benefit of her hard-won knowledge. Thank you, sir, Aurora said. But I'm done hiding. I accept the Navy commission. I want to teach. The admiral nodded approvingly. Then welcome back to the Navy, Lieutenant Bennett. The following week moved in a blur of paperwork, medical clearances, and psychological evaluations. Aurora passed them all, though her therapist noted with dry amusement that her anxiety symptoms had dramatically improved since she'd stopped pretending to be anxious. On Friday afternoon, Aurora returned to Balboa one last time in her civilian capacity. She'd come to clean out her locker and say goodbyes. The emergency department staff had thrown her an impromptu party, complete with a cake that read, "Thanks for not dying," which was apparently trauma nurse humor. Dr. Thorne pulled her aside. "I need to apologize," he said, "for how I treated you, for the assumptions I made, for being human?" Aurora interrupted gently. "You saw what I wanted you to see. I was hiding on purpose. You didn't fail some test, Marcus. I was actively deceiving you. Still, I was an asshole. Yeah, you were, Aurora agreed. But you're a good surgeon. And when it mattered, when those SEALs came in, you stepped up. That counts for something. Sterling joined them, looking uncharacteristically humble. I told NCIS everything about my conversation with that pharmaceutical rep. I've been cleared of wrongdoing, but I keep thinking about what could have happened if they'd succeeded in taking you. They didn't, Aurora said firmly. And now NCIS is rolling up their entire network. You made a mistake, Caleb. You owned it and reported it. That's all anyone can ask. She handed them each a business card. Her new contact information at Naval Special Warfare Command. If you implement that trauma training program, call me. I can send corpsmen to help with the curriculum. What happened this week? The SEALs coming in. The attack. It showed that this hospital needs to be ready for combat casualties. Let's make sure it is. That evening, Aurora attended her last team dinner as a civilian. The SEALs had taken over a beachside bar, and the atmosphere was celebratory. Tex, fully recovered and cleared for light duty, raised a beer in toast. To the Reaper, he announced, who saved my ass, kicked contractor ass, and is apparently too stubborn to stay retired. To the Reaper, the team echoed. Aurora felt her throat tighten. I'm not the Reaper anymore, she said. That was who I had to be in Fallujah. She gestured at herself, at them, at the moment. This is who I am now. I'm just Aurora. A corpsman who's going to teach other corpsmen not to make the mistakes I made. What mistakes? Havoc asked seriously. Thinking I had to do it alone. Thinking asking for help was weakness. Thinking that hiding from my trauma would make it go away. Aurora looked around the table at the faces that had become family. You don't get through war alone. You don't get through the aftermath alone either. I forgot that for a while. You reminded me. Breaker raised his beer. To Aurora, then. The corpsman who saves lives, kicks ass, and finally figured out that family has your back. To Aurora. Later. Walking along the beach with the sound of waves in the background, Aurora pulled out her phone. She had a text from Sarah Hendricks. Dad told me what happened. Welcome back, Reaper. My daughter wants to meet her namesake. Dinner next week? Aurora smiled and typed back. I'd like that. And Sarah, call me Aurora. The Reaper did her job. Now I get to do mine. She looked out at the Pacific Ocean, dark water stretching to the horizon. Somewhere out there, young corpsmen were training for deployments. Some of them would see combat. Some of them would face the same horrors she had. Some of them would come home broken and spend years trying to hide it, but not if she could help it. Aurora Bennett, former Reaper, current lieutenant in the Navy Nurse Corps, always and forever a corpsman, turned away from the ocean and headed back toward the lights of the bar, toward the sound of laughter and brotherhood, toward the family that had dragged her back into the world of the living. She'd spent 3 years running from who she was. Now she was running toward who she could become. And that made all the difference. My name is Lieutenant Aurora Bennett, she began. Some of you may have heard stories about a corpsman called the Reaper who served in Fallujah. Those stories are exaggerated, dramatized, and about 60% bullshit. She paused. But the important parts are true. I learned how to keep Marines alive in urban combat. I learned how to function under fire. And I learned that the most important skill you can have isn't medical knowledge or tactical proficiency. It's the ability to ask for help when you need it, and to accept that you can't save everyone. She looked at their young faces and saw herself 20 years ago, idealistic, determined, convinced she was invincible. This course is going to be hard, Aurora continued. I'm going to teach you things I learned in the worst moments of my life. But I'm also going to teach you how to come home whole, how to process what you see, how to take care of yourself so you can take care of others. Because being a warrior isn't just about fighting, it's about surviving what comes after. She smiled. So let's get to work. We've got lives to save. As the corpsmen opened their training manuals, Aurora felt something she hadn't felt in years. Purpose. Not the desperate, survival-driven purpose of combat, but something deeper and more sustainable. She was exactly where she needed to be. The Reaper had returned, not to fight, but to teach others how to win the battles that came after the shooting stopped. And that was the most important mission of all. The end.